I was about to begin violence, which we already did earlier on today, because we're talking about patient safety. I was at the hospital yesterday. Now, a day before yesterday was so chaotic for me. A day before yesterday, I think 2 days, I was also at the hospital. And when our guests, I'll introduce our guest in a bit, when our guest reached out concerning this conversation, this is how much we don't notice things, right? So when she said, Miriam, it's World Patient Safety Day, right? And I'm thinking, it is? There's such a thing as Patient Safety Day, right? Like there's such a thing. So I go to the hospital and I'm at the laboratory. And that's why I say we don't know unless somebody brings that attention to us. As I'm waiting for my results, I noticed where the lady was seated just behind her. The hospital had put the patient safety, yes, like the patient safety information there.
America.
Yes, like you have the right for this, you have the right to be treated, you have the right to see this, you have the right for medical care. And I said, where? I've been showing up and I've never... Sijaya inakwanga by the sijaya angalia until
hospital gun.
The hospital I was at, of course I'm not going to mention it.
You how to mention like
yes, but it's then I said wait. Hizi vitu zinakwanga.
Hizi zetu.
So today in studio we do have Elizabeth Kariuki, she's a neonatal nurse, and also we have Carol Agutu, she's the County Health Promotion Officer. 17th of September is World Patient Safety Day, which is today. And so we want to look at what does that even mean. So their theme this year is safe care for every newborn and every child. And of course, the accompanying slogan is patient safety from the start. Facts, it's so important. Emphasizing critical need to eliminate avoidable harm in pediatric and neonatal care setting from the beginning of a child's life. This conversation is very close to my heart. Good morning, Elizabeth.
Good morning.
How are you doing? Oh, there. So let's do that again. Good morning, Elizabeth.
Good morning.
How are you doing?
Fine, thank you.
Good morning, Carol.
Good morning, Mariam. How have you been?
Good. Leo imekuwa very violent, eh? And I'll just start, Carol.
Yes.
Most of us, when I told Salim today that it's World Patient Safety Day, and he said, is there such a thing? How is it that we do not know about this?
Yeah, true. Yeah, thanks, Miriam. Yeah, as you've said, today is World Patient Safety Day.
Yeah,
and as what I've said just means world. So it's all over the world.
Yeah,
and it's a day whereby we try to create awareness to the patient and even to the healthcare workers of what needs to be done in order to ensure that they are safe from their side as a patient and also from the side of the hospital and all the professionals. Yes, so basically it's a day where we create awareness and we highlight exactly what the patient needs to know, the rights that each and every patient has, the responsibilities that are shared between the patient and even the healthcare professionals, just to ensure that at the end of the day, everyone is safe and healthy.
Okay, so let's create that awareness. What is my right as a patient?
Okay, yes. The Constitution of Kenya.
Yes.
Where?
Has yes, Salim.
Yes.
The Constitution of Kenya outlines very well and clearly that each and every individual within the country has a right to live, has a right to healthcare services, and several other rights related to health. So for this particular World Patient Day, what we're really trying to emphasize to each and every person, because at any time you can become a patient, is that you have your rights, that when you visit a health facility, then definitely you can enjoy.
Yeah.
So for instance, one, as a patient, if you visit a health facility, definitely you've gone for to receive some sort of health services. So when you walk there, you have the right to information. What do I mean by this? As you go into the hospital, definitely you'll encounter the healthcare professionals.
Yeah.
And while you're being taken through or while you're being treated, because definitely it starts off with the trying to get exactly what is ailing you. getting the exact disease, that is diagnosis.
Yeah.
And of course, it has several procedures. You walk in, the healthcare worker has to find out from you, how are you feeling, and for how long has this been happening. And then, of course, you'll be directed that maybe if there's need for investigations to be done, then you have to be explained to what exactly is going to be done, what samples are going to be taken, where they're going to be taken, and how it's going to be done, and after how long you're going to receive your results. Yeah. So that's why I'm saying you walk in and you have the right to information. But as much as you have the right to information, to know exactly what is happening in each and every stage as you wait to get treatment and at the end leave the hospital, we also say that as healthcare workers, as a patient, you also have to speak up. You have to speak up, because if you don't speak up, then it means that as a health professional, it will be very hard for me to help you reach or get what is ailing you. That is, diagnose what is ailing you. So that's why we are saying it's a responsibility on the patient side and also on the healthcare professional. So if you speak up, I'll be able to know I'm having headache. It's on this side of my head. It's radiating down to my eye, or to the back, and such things. If I take this type of a medication, I usually get allergies, and so I was told that I should never be given this type of a medicine. So that is what I'm saying, right to information. So both sides. You give me information, but at the same time, you also have to speak up in order for me to be able to help you. Apart from that, there is the bit of the sharing of accurate information that falls still under information. Then we have the issue of following instructions. So as I've said, I've walked you through from the moment you've entered the hospital. You've spoken up. You've told me each and everything that is happening to you. I've taken samples, results have come out, and then you get a prescription. Medication is written to you, and you're given information now, or other instructions. Please, this medication is supposed to take it twice in a day. That is very early in the morning and late in the evening before you go to sleep. So again, from my end, I have to give you the clear information of how to take this medication for me to be sure that you will somehow at the end of the day, the medication will help you and you get cured. But from your end, again, now I expect you to follow the instructions that I've given you, so that at the end of the day, you're safe. We don't end up with the antimicrobial resistance in terms of, I've given you medication, you're supposed to take it twice in a day, in the morning and in the evening for 5 days. But once you leave the hospital, you start taking the medication, you take it maybe for 2 days and you start feeling a little bit better. Then you stop.
All right. So in terms, in instances where now you go to the hospital, and I'll take you now to the patient side, where you always go to the hospital, and most times we feel so helpless when you go to the public hospitals and even the private hospitals. As zingine unajiuliza, why am I being treated like a beggar in a hospital? There's very, when it comes to responding to a patient, it's slow. And at times you go to the hospital at 8 in the morning or even 7 and you end up leaving that place at around 5. In fact, most of the time unapona. You sit on that chair. Unapona ukisubiri.
Ugonjwa unatoka.
Yes. And you're
pepo inakimbia.
Wait. What is going on? I please address that, because it's a challenge.
Ama hiyo haiko kwa hii nini? You see.
No.
It is part of the patient. It's part of the patient safety day. And as you said, I'm a healthcare worker.
Yes.
And I'm not here to defend the healthcare workers.
Yes.
I'm here to just highlight exactly what should be done on the side of the patient and also the side of the healthcare worker. When we are going through training, that is, you go through training and then now you graduate, and of course you're given the powers to go out and serve the community. Definitely there are procedures that you have to take, or rather there are processes that you must put into place so as to ensure that you serve the patient well. In our working stations, you will find that we have different people. and definitely different individuals have different attitudes, different behaviors, and so you may end up expecting, unfortunately, you might be able to get some flaws in both the healthcare workers and even in both the patient. But the ideal situation in each and every health facility, we are supposed to treat the patients in the best possible way that a human being deserves.
All right.
Sivyo?
The ideal situation, lakini kwa ground
Vitu
vitu ni tofauti.
Sasa wajua kitu moja ni vitu zitakuwa tofauti. Utapata pengine vitu ambazo unapaswa kutumia pengine kidogo hakuna. Ama unapokuwa unaendelea kuhudumia mgonjwa, utapata kuwa wagonjwa wanakuja and then unfortunately pengine zinapungua. So all these are things that are there. Some of them are inevitable, but some of them, even as healthcare workers, tunajua kidogo kuna flaws ambazo tunazidi kila siku, kila uchao.
Yes.
Tunazidi kujaribu kuimprove. Sivyo? Yeah, and that is why tunazidi kukua na different departments, kama kuna quality assurance. So these are departments that are coming up just to ensure that each and everything is put in a place and patients get the best possible treatment and services within the health facilities.
Sijui kama hii ina fall hapa, lakini utaieleza. Umesema safety, iko hapa, the word safety iko hapa. In some of facilities, I'm not going to mention where, ndio mtu asikue msifuatane hapa mkaenda kunani. Uchafu kwa hospitali mpaka amende kwa hospitali. Jameni, si mshirikiane mfanye usafi. Nao tuacha tuseme tutoke. Government government nini? Hizi za government hizi.
Public hospitals.
Sitataja gani.
Kile na ambacho naweza kusema ni kuwa
na
kama vile nimesema tuko na vitengo tofauti hospitalini ambazo lazima kila mtu akona roles and responsibilities zake za kuhakikisha kuwa hospitali maeneo ya hospitali iko sawa. Na kama afisa mhamasishaji wa afya, ningependa kusema hivi, tuna vitengo hivyo vyote hospitalini, sivyo? Na wote wanafanya jukumu yao, sivyo? Na utapata kuwa pahali kuna binadamu kidogo,
lazima mtateleza.
Kuna binadamu, kuna chakula. Hizo vitu zote zikiwa zimewekwa pamoja, lazima tuhakikishe kuwa tunajaribu sana kuhakikisha kuwa mazingira inakuwa safi. Na ni hivyo tunafanya. Utapata katika sehemu yetu kama hospitali na wauguzi hata wahudumu wa afya, tunajaribu, sivyo? Lakini pande wa mgonjwa pia lazima shikane sote pamoja. Yaani ni teamwork. Sisi pande yetu kama hospitali lazima bado tuungane pamoja na mgonjwa, sivyo? Ndio tuhakikishe kuwa mazingira inakuwa iko sawa. Sivyo? So tunaweza kuwa tunajaribu pande moja na pande nyingine hatujaribu. Ikilegeza sasa, unajua at the end of the day kutakuwa kumeharibika. Na ndiposa tunasema kwa leo, hata najua ndio bado tunaendelea, lakini ningependa tu kuwashukuru sana kwa kupatia hiyo fursa ya kuweza angalau kuongea na kuweza kuwafikia jamii yetu kwa jumla kuhusu maneno ya World Patient Safety Day. Na ili tu kuweza kuwaelezea na pia kuwahimiza kuwa ni lazima tushikane tukiwa pamoja.
Okay.
Teamwork.
All right,
ndio tuweze kufika pahali.
So we are speaking to Carol Agutu, and she's a county health promotion officer, and of course we also have Elizabeth Kariuki, who is a neonatal nurse. I know Carol is being politically correct today. We'll allow certain things.
Tunakuwa wapole kidogo
sana, amejaribu kutetea lakini Elizabeth, today's the theme for World Patient Safety Day 2025 is safe care for every newborn and every child, right? what are the major risks to newborns and young children between the ages of 0 to 9 years? What are the major risks?
Major risk?
Yeah, the major risk to newborns and young children. In terms, it's World Patient Safety Day, right? So what are they at risk of?
I'll say the first thing is that a big category of them mtoto hawezi kujiongelelea. They can't express themselves.
Yeah.
So it's for the parent to try and interpret. You see, so that's what I'll say. It's the major risk because haizi kujitegemea yeye mwenyewe. They depend on the other party.
Yeah.
So it's up to for the other party to be at par, so that to give the safety and the kind of care that is required for that child.
Yeah.
And as the slogan was saying, safety first.
Yeah.
So you'll see it's something I'll say before we end up in the hospital. I'd like to throw the ball back to the parents and the caregivers. They have a major role to play so that we reduce the incidences of them visiting the facility. Whereas if that is done right from before conception, prenatally, we can avoid the kushinda kuja hospitali, mtoto kushinda akiwa sickly by the simple basic things that we can even do at our homes, which will greatly reduce the exposure to getting sick and even death. Yeah.
Let's debunk the theme when they say safe care for every newborn and every child. What are we not doing right when it comes to a child health safety?
Okay, I'll go before somebody conceives,
Okay.
because ideally, if somebody is planning to get a child, then they're supposed to visit a healthcare facility for checkups before conception, because there are some things. If in a woman, let's say the level of the folic acid and the rest, if they are low, then they have a very high chance of even giving birth to babies who have their own abnormality, congenital abnormality. So you can imagine from exposure before conception to conception up to the time of delivery, then already this baby is at a risk. Okay, then there are the antenatal visits, where the mother, when they are pregnant, they're supposed to visit the hospital for their checkups and all that. So if somebody missed that, that baby, from day one when they are being born, they are at a risk of becoming sick. So their safe care already has been compromised compared to the one whom the mother visited the hospital prior conception and has been visiting the hospital during pregnancy. And then place of delivery. It's unfortunate, but up to date we have people still giving birth at their homes. So a baby born in the hospital, the kind of care they get can't be compared by the baby mwenye amezaliwa nyumbani, wengine bahati mbaya kwa matatu. You see, the aspect of infection prevention, the two can't be compared. So already this baby who is born out of the hospital already has been exposed. Already the safe care has been breached, unlike the other one. So from there, now we continue. The cord care, breastfeeding the baby, immunization, and it's so unfortunate. Most of the people, they terminate immunization at age of 1.5 years, whereas it's something supposed to go on up to 5 years. And then what do we say? Watoto wakiwa chini ya miaka 5 wanashindwa kikuwa wagonjwa, but have we followed up? Ama tuli withdraw at 1.5 years. You see.
Kwa hivyo hiyo ni yetu tumejiwekea. Less than 5 mtoto anakuwa mgonjwa, kumbe hafai kuwa mgonjwa.
So once the proper care is done, you'll find that will reduce the incidences of having sickly babies around.
Okay, so proper care, but because from what you're saying, the proper care now begins. It starts from home. Right? It starts from, again, the parents. Now, let's look at Kenya's mortality rate. This is now a report that I'm looking at 2024, right? So Kenya's maternal mortality rate was reported at 355 deaths per 100,000 live births in mid-2024. This is according to the UNFPA in Kenya. Why are we seeing a rise in that? Where is the negligence?
Unless now you break it down, we see the causes. Each cause with its percentage.
Are there things that can be, how do we say, is there a way that we can reduce the mortality rate? Is there a way that we can reduce this at the hospitals?
I'll say, self-care, more so for neonates and children, I'll say it's about teamwork. You just can't point a finger at one person. Ukichukulia tu mfano ya hii jiko ya mawe 3, ukitoa jiwe moja ama uweke jiwe moja ndogo, huwezi sema eti hizi mawe zingine zimefail. So when we try to point so much at the hospital, each party has a role to play. And what I know is that nobody went for training just to come and watch people die. By the way, that thing is so frustrating. So for me, I believe somebody kujitolea kwenda kusoma mambo na sipitali, somebody to be a healthcare provider in the facility, every day they wake up with this mentality like, I'm going to save life. So maybe we should look back at maybe what we as the community, what are we not doing right? Because I believe from our end, we are giving our best.
I'd like you to look at both sides, because I really want you to look at both sides. I don't want you to just focus on the healthcare providers, because there are patients who will go to the hospital and talk about negligence. We cannot ignore that, right? So let's look at both sides. When it comes, you've talked about the patient. When you get pregnant, you need to go to the clinic, right? Go to the hospital, go to the clinic, ensure that the child is immunized, right? Now, when we get to the hospital, we talk about negligence, and it's not a lie. We see it. So what I'm asking is there a way to avoid the negligence that we see in some of the hospitals?
Yes, Miriam, just as I said.
Yes.
We can't say it's negligence per se. As I was trying to explain, safety all the way from the start, yeah?
Yes.
Yes, so it's also, as much as we might find some flaws in the health facilities, it is a two-way thing. You find that we are talking about safety right from the start. You've talked about maternal mortalities. And I was just going to tell you that if you break it down, you will find that there are some counties that the maternal mortality rate is high. And so when combined together as the 47 counties, that is when you find that now the mortality rate for the whole country now goes up. But interventions have been put in place, because you can imagine just that one mother dead. That's a big thing. It's usually a big thing in healthcare.
Yeah.
So interventions have been put in place, and we need to work together. You find at times that a pregnant woman will come to the health facility when it's too late. Why? There was delay at home, and this delay we can also attribute it to maybe lack of awareness. That is one. But two, you'll also find that there's some cultural practices that also work against the health services. This particular lady who is most probably pregnant, try and maybe just follow the history of what was happening during the whole journey of pregnancy. You will find that there are some cultures, things like massaging the belly, and this is one person who is massaging the belly who does not know anything to do with the anatomy, the physiology, and anything else as concerns the pregnancy. So you find that at times the patient walks into the health facility when it's too late. And that's why, as a department, let me talk for Department of Health. As a department, we try to create more awareness of what should be done right from conception, throughout the pregnancy journey, and even during delivery.
What should be done at the hospital? So
at the hospital,
yes,
of course, that's what I was trying to explain. You come in late. But if you just find it's a regular pregnant woman, they shall have known exactly what is expected of them. You're pregnant, anytime you start seeing the signs suggesting that you're having labor, please get to the hospital. At times you find that an individual is a first timer. That is the first pregnancy. And for a first pregnancy, it's like we don't know exactly what to expect. You've never delivered, and so you need to be looked at closer. And that's why you'll find that there are even some health facilities that cannot handle a first time mother. Like you're going to deliver a child for the first time, you will be definitely sent to a more established health facility. We have different levels. We have level 0, the community, level 1, 2, 3, 4, 5, up to 6. So you'll find that the lower levels, somehow, if you're it's your first time to deliver, that's your first pregnancy, you will be referred to a health facility where they are more
established.
That is more established, that has several other services. So such that in case you need to be taken to the ICU, in case you need to be taken to the theater, you'll be able to go. You will be able just to be transferred as fast as possible, because we still don't know exactly what to expect. It's your first pregnancy.
Okay.
We don't know whether complication will happen or not. So, but some people, you find that some of the mothers, they walk in late to an extent that even you as a healthcare provider, as you really struggle hard to try and get the high health, to try and match the blood, to get the blood group, to try and find out if at all several other things were done during the beginning when you are starting off your antenatal clinic, whether all these things were done, because you've been brought in, no records, you don't even have a book. So there are some things that happen, but from the hospital, we usually try to ensure that we do not end up with a maternal death, because that is something, it's a big thing, it's a big loss,
Okay. Karo, wacha to debunk kitu. I have the experience. Sawa? Nazungumzia I have the experience kwa sababu the people that I have been with around, they've been going to that procedure from sijui kuweka mazingira, nataka mimba, anaweka mazingira venye Liza ameeleza. Na hizo clinics zote, sijui hizo matembe mnapewa na zingine ni syrup. I know those things. Ikifika hapo kwa delivery hapo, ujipate kwenye hizi hospitali, huyo mtu mwenye anakuhudumia, that's what Miriam anatry kuuliza.
Anajaribu kuuliza.
Huyo mtu mwenye anakuhudumia, yale maneno, Miriam nasema uongo, maneno yenye yanatoka kwa mdomo wa Karo. Unaweza juta kwa nini Barisa alinipatia mimba. Ama kwa nini nilikaa nikapata mimba. It's real. Na huyo mtu amekuwa akienda huko clinic. Tuachane na huyo mwenye amekuja late, records hakuna, unajaribu kutafuta damu na hiyo ni frustration. But this is a person mwenye amekuwa akienda. Sasa imefika ni hiyo siku ya hata wengine wanajuanga date yangu ni siku fulani, so anajileta before. Basi sasa ikifika hiyo siku ya kwamba sijui sukuma, maneno yenye inatoka kwa Karo,
Barisa,
mtu anajuta. Why should I even, hata si mtoto atapata trauma na hata haelewi.
Barisa,
there are facts ziko. That's why Miriam anauliza what should be done at the hospital.
Yes, na nikasema kama tulikuja hapa ili tuweze kuhamasisha jamii, sivyo? Na nikasema sikukuja hapa ili kuweza kutetea wauguzi ama wahudumu wa afya.
Ndio.
Na nikakubali, nikasema kuwa utapata kuwa kuna flaws ambazo pengine hutokea, sivyo? Na nikasema kuwa ndiposa kuna vitengo vingine ambazo zinazidi wanasema kubuni,
kuweka mikakati.
Mikakati. Tuko na vitengo zingine kama quality assurance, tuko na grievance redress mechanism, zote ambazo tunazidi kuleta ili tuweze kupatia wananchi nafasi ya kuweza kuongea kwa uwazi na kusema kuwa nilienda kwa hospitali fulani, ni yale matibabu ama jinsi nilivyoshughulikiwa haikunifurahisha.
Chukuma ama ukae kando.
si unaona jinsi nilivyoshughulikiwa sikufurahia. Sasa wajua through your grievance redress mechanism tunaweza kujua. Wajua sasa mgonjwa anakuwa ako wazi kutoa ujumbe bila kuogopa kuwa yule muuguzi ama mdumu wa afya ameniona, nikirudi tena ataweza kunipatia services vizuri. So we have, ndo nasema kuna departments zingine ama vitengo, units zingine ambazo tunazidi kutengeneza ili tuweze kupata fursa ya kuhakikisha kuwa kila mgonjwa anayekuja hospitalini anapata huduma sahihi. Na unajua yule mgonjwa ndio anajua ni wapi amekosewa, akupenda nini. Sasa akitujulisha kupitia hizo grievance redress mechanisms, inakuwa rahisi sasa kama department kupick na kuhakikisha kuwa tunaenda chini na kutafuta kwa ni sababu gani unafanya hivi, ilhali unapaswa kuhudumia mgonjwa hivi na hivi. Waona?
All right.
Yes.
So Elizabeth, since you're a neonatal nurse, during today's World Patient Safety Day, what should the listener know?
Pardon?
What should the listener know?
First thing that they should know is that correct information will really help. And then the other thing they should know is that I think it's the high time we set aside our cultures. Kuna kama utasikia mtoto sijui amekatwa kilimi, alikuwa anakohoa sana, you know, which it's really endangering the life of the child. So anytime you see your child has maybe difficulty in breathing, the child is not breastfeeding, the child mwili komoto has fever, that's the right time to go to the hospital. Yeah. And another thing, I think people have, I don't know, should they say negative attitude towards the hospital, but we are always open, ready to help, so they should come to the facility to seek help. And for them, when they are at home, to observe hygiene, vitu tu zile za kawaida, hand washing, the coughing mechanism, covering the mouth, would really help.
How do you build that trust when you talk about negative attitude towards the hospital? Again, it will go back to the experience that people get at the hospitals. How do you build that relationship between the patient and the healthcare providers?
Okay, I'll speak for me.
Yes. Yes.
So for me, one thing I do, even when I'm at work, is that before every procedure, I'll have to explain it to the parent. You see?
Yeah.
So mami, there is 1, 2, 3, nimeona kwa mtoto, ningependa kufanya 4, 5, 6. So that all of us will be at par. And it's so unfortunate that sometimes I had to put my foot down because somebody will be like, mtoto ni wangu, mimi sitaki. You know, people still have very funny beliefs and religion, which I'll also categorize it in culture, but some it's out of their church. The child is not supposed to be transfused, I don't know what, whereas the life of that child is at stake. So sometimes you'll find the healthcare people putting their feet down. It's not because they really want to but the situation demands for so.
Okay. Carol,
Yes.
what should the listener know today during World Patient Safety Day?
Yeah, one thing that the listener should know is that each and every person or each and every patient deserves safe and quality care. And they have the right also to speak up. Speak up and say that the way you are treating me, sipendi. They also have right to information. Nataka kujua ni nini na nini unataka kunifanyia, unafanya hivi kwa nini. So they have a right also to demand information.
Yeah.
The other thing is that what else I would like them to know is that patient safety is a two-way thing. It's each and every person's responsibility. So si jukumu la daktari peke yake, ni jukumu la mgonjwa na hata ya wahudumu wa afya. So it's important that we join hands together, just to ensure that at the end of the day, each and every patient is safe. So we have to do it, all of us.
All right.
Play your part, and I should also play my part. Then when we meet at the katikati, basi tunapata kuwa safety ipo. Kama hujatendewa vizuri, that's why I'm saying speak up. Sema sijapenda hivi, and then from our end tutashughulika, tuseme mbona huyu mgonjwa alihudumiwa hivi vibaya.
Okay.
Yeah, because at the end of the day what we want is safety.
All right,
to each
then.
and every patient.
All right, then. We've been speaking to Elizabeth Kariuki. She's a neonatal nurse, and also Carol Agutu. She's the county health promotion officer. And today it's 17th of September is World Patient Safety Day. And I hope you've known about your right today. And you know that when you get there, you can speak up, okay? Wakikurukisha line, you speak up and say, Z.
How to speak up? You did not speak up.
Yes, and also if you feel like the state there is not good, no. And I like what you've said, that nobody wakes up to not perform their duty or their role, right? Yes, so I think that's my take home today. Yes, we'll be looking at the role of healthcare providers in ensuring patient safety, and then also your role as a citizen.
Kuhakikisha nurse anafanya kazi yake kwa uzuri na daktari.
Yeah. Thank you so much for making time. We will be right back. Good morning.